Welcome back. Here we talk about pulmonary arterial hypertension. Please note that this is different from systemic hypertension. Okay. Now, pulmonary arterial hypertension is where the blood pressure within the pulmonary artery is greater than normal. Okay. Pulmonary arterial pressure is typically 8 to 20 millimeter mercury. And now you could see a situation such as 25 to 40 millimeter mercury or 41 to 55 millimeter mercury or over 55 millimeter mercury. So based on the pressure there is, you would give the name mild, moderate, or severe pulmonary arterial hypertension. As you are very well aware, the location of pulmonary artery is such that it bridges the right ventricle to the lungs. Okay, so if there is some situation in the lung, like pulmonary hypertension, that could resist blood from reaching the lungs, and therefore the pressure within the pulmonary artery can be greater than normal. And think about it like this: pressure in the lungs could be greater because of the left side heart disease, where blood backs up into pulmonary veins, and then that causes a pulmonary congestion, and then that could cause pulmonary artery hypertension. Okay, so here we have a few listed: increased resistance to blood flow, that is because of higher than normal pressure within the lungs. In our blood vessel injury, blood vessel being narrower than normal, that is where you think about genetic condition or vasculitis, or maybe there is occlusion, maybe thromboembolism, correct? So one of those situations can cause resistance to blood flow. Increased pulmonary venous pressure, that is left heart disease, like we talked about earlier, that is a left heart disease, blood not able to fill the left ventricle, so it backs up into the pulmonary vein and cause pulmonary congestion and hypertension. Or pulmonary blood flow, increased pulmonary blood flow. Typically up to about 4 times cardiac output, it doesn't really affect the lungs with increased volume. But if it is way beyond that, you're thinking about a pulmonary congestion. Okay, so those are some causes. You will see many more very soon. So let's talk about some more details. The cause could be genetic predisposition, sustained vasoconstriction, local remodeling, again, inflammation, injury, remodeling, and destruction of some small pulmonary arteries, or pro-apoptotic insult. Okay, so programmed cell death in the vascular endothelium. This is pulmonary artery. Okay, endothelial dysfunction causing selection of apoptosis resistant cell populations. That could be the cause of lack of elastic nature, and that could be the result of remodeling or stiffness. And plexiform lesions. Plexiform lesions are growth of small vessels, very small ones, around the blood vessel because of the closure or the narrow lumen of the main vessel. Okay, so you may have a bunch of small vessels around where they're not functional. They're just there to overcome the circulation problem, but then they cannot really replace the main vessel. Okay, so this leads to progressive right heart disease. When blood backs up in the pulmonary artery and eventually into the right side of the heart, here is the congestion within the right ventricle and then the right atrium, etc. Okay, so the symptoms and signs are related to the lung function and then the right heart failure. Okay, so it is difficulty breathing on exertion, that type of thing. So it's a gradual change within the right side of the heart, ultimately leading to right heart failure. So let's take a look at a number of causes here. One of them is idiopathic, meaning the cause is unknown. Heritable is genetic. A number of genes, defective genes are shown, again unknown genes. Then the drugs or toxin could be involved, associated with connective tissue disease that would have poor development of the connective tissue within the blood vessel wall. And then it could be infection, portal hypertension, that is the liver, hypertension in the liver. And then blood cannot enter the liver, so it backs up in the right side of the heart and ultimately pulmonary trunk and then even the lungs. Okay, congenital heart condition could be one. And then other types of diseases that we really don't want to invest in. So pulmonary hypertension due to left heart disease, which we talked about, pulmonary hypertension due to lung disease and hypoxia, and then chronic thromboembolic pulmonary hypertension and pulmonary hypertension with unclear multifactorial mechanism is yet another one. So there could be many, many other causes. Sarcoidosis is one thing that causes a connective tissue abnormality, for example. Okay, so there are other conditions listed, but do not go through the details of this. Our goal is to understand pulmonary arterial hypertension. All right, thank you.